everybody, I'm Mandy and we're here with Dr. Indibor Yengkhom. He is a radiotherapist, that is a cancer specialist.
Hi everyone, I'm Dr. Indibor. I'm a cancer specialist. I work in the Regional Institute of Medical Science in Manipur here as a cancer specialist for last 25 years.
We're pleased to have you here, sir. And here are some questions. Cancer is a very unpredictable disease and known for its difficulty of treatment. There must have been some cases where curing is totally out of the question. As a doctor in this particular field, do you deal with this kind of situations?
Yeah, you're right. Cancer is unpredictable because it strikes out of nowhere. Lives. The person doesn't usually know cancer is coming. Only when it's very in the advanced stage, usually most of the time, the doctors detect that you have cancer. So in that way, it's a sort of unpredictable and sort of a disease which is very, very, so to say, frightening. Okay. So as a doctor, if you ask me that cancer is a type of disease which is born from your own cell, and it cannot be predicted because it comes suddenly. Any of your cells in your body can become a cancer cell. Say, it may be a somatic cell usually most of the time, or it may be a germ cell which becomes abnormal. That is, it becomes genetically, we say the cell has got mutations, mutated genes. Then
does it occur by itself, or it's
okay? It occurs most of the time not by itself, but by the environmental factors. We call it acquired carcinogenic agents. And of course, it occurs as a hereditary, as a familial type, because you inherit a defective gene, either from your mother or father or from both. Then in that case, it is, you can say, spontaneous disease. It occurs by itself.
So all types of cancer is transferable to the child?
The hereditable, the genetic type, but they are very few. About less than 1% will be the familial or hereditary type. But by and large, majority of the cancers are acquired. Means when you are born, then you are exposed to the environment. So many factors, maybe physical factors, chemical factors, biological factors like virus, bacteria, physical factors like exposure to ionizing radiations, chemical factors like taking some poisonous toxic substances. So all these may produce cancer, and even the sun itself can cause cancer. The UV rays. So we are exposed to the environment, and our body immune system protects. Most of the time we overcome the cancer, but sometimes our immune system cannot protect, then cancer starts.
Okay. So when you're talking about these factors that causes cancer, so it's been said that smoking is one of the main factors for lung cancer. Can you please elaborate on this?
Actually, as by the time you are taking me the interview, the time is ticking away. May 31st is approaching. It's celebrated as a anti-tobacco, World Anti-Tobacco Day. So we are concerned about the tobacco because tobacco has been known to reduce more than, say, 30% of all the cancers. Of all the cancers, the cause is traced or related to tobacco uses. Tobacco use in any form, maybe smoking or smokeless type, they like chewing and etc. Why tobacco causes cancer is that we have identified more than 50 carcinogenic agents in tobacco. So that's really very frightening. And another important thing is that tobacco can be prevented. I mean, the cancer caused by tobacco can be prevented if we can ask to stop or people to quit tobacco, then we can reduce the incidence of cancer. So that's why tobacco is very important as a cancer specialist. I would like to request or ask everybody that please don't use tobacco in any form, or if you are using, quit, or if you are not using, never try.
Don't smoke, kids. Okay, so the next question is, can you explain briefly about the stages of cancer?
Yeah, people ask to me, any patients that, doctor, what is my stage? They are very much concerned that, I don't know, the public seems to be aware that the cancer, of course it is true partly, that cancer it comes in the early stage, they are curable, and in the late stage, it is almost 100% incurable, I should say. So what happens is that we try to detect cancer in the early stage. Briefly for the public, for the general, I would say that we divide cancer into, or group into 3 stages. Early stage, locally advanced stage, and the metastatic or late stage, we can say. The late stage or metastatic is, we can say, is the stage 4, which is not curable. So, if cancer is detected in the early stage, 50% of the cancer can be cured as of today. So, you cannot say that cancer is not curable. It depends on the stage. And that's why you are asking what are the stages. It's very relevant. Many patients want to know at what stage my disease is. That is their most, I should say, foremost concern at the time of diagnosis.
So it's been going around that breast cancer is a major factor for the death of so many women all around the world. So can you please tell us the symptoms of breast cancer so that women can check by themselves so that there can be an early detection?
Yeah, absolutely right. Breast cancer is the combination, of course, in the female gender, I should say. The male can also have breast cancer, but very less, 1%. But when we talk about the breast cancer, we usually mean the female breast cancer. Female breast cancer incidence is rising. Initially, we thought it is in the developed countries. India also, breast cancer has become number 1 malignant disease or cancer in females. Now, the breast cancer, why it is very important is that if we detect early, not only we can cure the cancer, but we can save the organ. We don't need to amputate the breast. So that's why your breast self-examination early detection is very, very much relevant. Very important. It's a very pertinent question. Nowadays, we try to save the breast as well as save the life. Otherwise, if you amputate the breast, then the female, the person loses her image, femininity and others. And this, necessarily.
The mammary glands also.
Yeah, the mammary glands amputation means we call it, usually the operation we do is MRM, modified radical mastectomy. That is the standard operation most of the time. Nowadays, we are going towards breast conservation surgery. Means we try to preserve the breast by removing the tumor or the lump only. So in that scenario, in that situation, what we require is that we want to bring an awareness to all the ladies, to all the females, right from the school age, from the adolescence till the menopausal at least, to be aware about the lump in the breast, how to detect it, and how to report it. Of course, doctors have a program how to screen the breast cancer screening program. But that cannot be, accessed or cannot be reached to the mass, to everybody. And perhaps it's also costly and say like mammogram, digital mammogram will not be available in the rural or far remote places. So, of course, if you speak, if you as a doctor, I will say that breast self-examination is not very relevant now, because when you examine and detect a breast lump, the stage is already left. We want to detect it before the breast lump becomes palpable. So a mammogram does it, and it does it almost very accurately. More than 90% of the time, the mammogram report is correct. So we have the mass screening program like mammogram and others in place. But as thus I have told you, this may not be, mammogram is not available in most of the developing countries, African countries, in most of the rural India. So at least if one examines the breast by herself regularly, say maybe during the taking a bath like that, and she detects an unusual lump and nodular, which is not painful usually, then they should report to you. That is what is called as breast self-examination.
Yes. And you mentioned that the number of breast cancer patients are rising.
Yeah.
So why do you think that is?
Okay. We have got a lot of hypotheses for that. We don't know exactly why the incidence is rising. The series, the series, the surveillance and results, one analysis team is there. The series report says that, in fact, breast cancer incidence is not rising. The incidence is increased because the awareness has increased. People has detected early, and they are coming more and more. So the last few years, it seems as if the breast cancer incidence is rising. That's one reason. The other thing is that in developing countries like India, the lifestyle, they blame it, the lifestyle has changed a bit. We try to imitate the Western lifestyles. Western lifestyles doesn't mean that we took tobacco or smoking, but we become more sedentary, less physical works, and also say we are taking more of the junk foods, fast foods and others. And tobacco usage also is incriminated as a cause. So increase of these uses of tobacco, less physical works, and taking the fast foods, junk foods, preserved foods, all these are pointed to be the cause of the increase in the breast cancer in developing countries.
Okay, so I think all the advice that you gave about cancer will be very helpful to the general public. And yes, we have a few more questions. What would your profession be if you chose not to be a doctor?
Yeah, actually, I want to be a scientist. My original, before I pursue for the medical, I'm interested in physics subjects. I was trying to study the course of physics. I'm attracted to the physical science, everything, whether it is theoretical physics or the classical physics. I'm more interested to the quantum physics, which now I'm using it as a radiation oncologist. We use a lot of quantum physics, applied nuclear physics in the treatment of our cancer patients by ionizing radiation, or by using the heavy ions or proton beams or neutron beams, and all these related with the physics.
So even if you had chosen medicine as a course, you still get to work with physics.
I still get personally to use some of the physics science.
And do you have any advice for people who are aspiring to be doctors?
Well, I would love all the people who love this profession. It's a little bit sort of challenging, but I would welcome them. I would motivate them, and they should go, because this science, this medical science, is very, very challenging. It is not like the other science, because here it's a combination of, or you can say the combination of both art and science. Because we used to say in the medical science that 2 plus 2 is not always equal to 4. So a person like, say, which we thought is cured will die suddenly. A person which we thought that this cancer patient is a gone case, hopeless case, survives also. So there are so many intricacies, so many things, and that's why it remains an ever challenging subject discipline, and also the medical science. I love, of course, another part is research work, and the more you do research work, the more you know it. Now you know that we are on the brink of producing the artificial pancreas, artificial kidney, or artificial liver. Means we can, from the stem cell, we can grow the liver. If you have a liver failure, we'll put a liver from your preserved cord cell, stem cells. So this is a lot of
better if
like that. Yeah, it's a very, very challenging,
we
very
preserve
interesting.
the umbilical cord.
Yeah, cord stem cell. Things are going. We can in future we can clone you. Exact similar. We'll take.
I don't think I would want to clone myself.
Yeah, you may not like it, but
Yeah.
scientifically, of course, it is so many different problems there. But we can make an exact replica of you. So it is a biological science or medical science is moving very fast and technology advancing. So like other discipline of the science, it's very, very challenging.
So what would you say is your favorite part about being a doctor?
Yeah, my favorite part, if you ask me, is that the day I'm most happy is that when I serve the life of a patient, particularly the children, because I am very much attached to the children. Even 90 years old, I don't mean that the 90 years old life is less important than a children. If he dies, then I thought that he has attained a right age. It's time to die, time to live, time to be born. But if you see a 1 year, 2 years old, sometimes it is the only son or very precious son, and stuck with a very, say, fatal cancer. Cancer has got some are very highly fatal, like say leukemia, blood cancer. Then the trauma the parents undergo, the child undergo for the treatment, the prolonged chemotherapy, radiation therapy, and bone marrow transplant, long treatment. It's sometimes it's emotional. I mean, it is very heart-breaking type sort of this thing. And most of the time, at the end of the day, most of them also succumb to the disease. If they come out from that disease also, it's not that, the number is not that high. So if I saw a pediatric child, I mean, suffering from maybe incurable or maybe a fatal disease, survives or is cured, that is the most rewarding moment of my life, I should say.
Well, I wish to thank you, sir, for being a guest for this interview for Global Scribes. And as an aspiring doctor, then I have to say that you have inspired me a lot. Well, thank you for your time.
You're welcome.